Hello, my name is Dr. Jeffrey Kottman. Welcome to the Long Island Institute for Advanced Dental Studies at Murata Dental Studios. We're currently in the surgical suite at Murata Dental Studios and getting ready for the placement of a single-tooth dental implant. Following the administration of local anesthesia, we'll use a surgical guide created at Murata Dental Studios to place a single-tooth dental implant with a minimally invasive technique using a punch technique. We're now going to place the surgical guide, which will allow for implant placement in the ideal position, both surgically and prosthetically. Additional local anesthesia is being administered to provide both adequate anesthesia as well as hemostasis for the implant procedure. A guide sleeve in the surgical template will allow for the perfect positioning with the placement of a 2mm twist drill just fitting through that titanium sleeve. The first 2mm twist drill is now being used through the surgical guide to mark the position for our implant placement. It's important that the surgical guide is extended far enough anteriorly to allow it to be held firmly in position without interfering with the surgical site. After the use of the 2mm twist drill, a guide pin that fits into that 2mm site is placed to ensure the accuracy of placement. A soft tissue punch is now being used to remove the soft tissue to allow us to continue the creation of our osteotomy or implant receptor site. The soft tissue punch should be of a diameter equal to or slightly larger than the anticipated implant. A periosteal elevator is now being used to help remove the soft tissue covering the osteotomy. After removing the soft tissue, the 2mm osteotomy can then be taken to its complete depth prior to expanding the osteotomy with successively larger twist drills. Noble BioCare surgical kit has been designed to allow for appropriate osteotomies according to the bone density. This osteotomy has been enlarged to accommodate a regular platform replace select fixture. When placing this fixture, the dimple on the fixture driver needs to face to the buccal, therefore ensuring that the lobe of the replace select implant is appropriately oriented for a standard abutment. In this case, we're using a manual torque driver to complete the placement of the implant and ensure that the dimple is appropriately oriented. At this point, a healing abutment is put in place. Gauze is placed towards the back of the mouth to prevent the healing abutment from being dropped. The healing abutment is tightened down, and a radiograph will be taken to ensure that the healing abutment is completely seated.